Hospitals with long line, people wearing masks. Again, lab researchers screening virus samples. Headlines first, new COVID variant detected. HX.1 spreads across US. Mask mandates return in some areas. Just when many believed the worst was behind us, COVID-19 is once again making headlines. A new fast-spreading variant known as HX.1 is now present in over 30 US states, raising concern among health officials and triggering renewed safety measures. HX.1 first identified in Southeast Asia earlier this year is a subvariant of the Omicron lineage, but the significant mutation in the spike protein that make it highly transmissible and more resistant to exciting antibodies. Animation of the virus structure, lab tests, and sequencing reports. According to the CDC, HX.1 now accounts for more than 40% of new COVID cases nationwide and is quickly becoming the dominant strain in parts of California, Texas, New York, and Florida. Crowded emergency rooms, COVID testing lines, public health announcement. With most cases remain mild or moderate, hospitals in some states are reporting a rise in admissions, especially among seniors, immunocompromised individuals, and unvaccinated populations. Doctors in PPE plan patients on oxygen, charts showing upward trend in hospitalizations. In response, local officials in at least a dozen cities, including Los Angeles, Chicago, and Miami, are recommending or requiring indoor masking and in school, airports, and public transit system. People putting on mask sign, reading mask required, press conference from city health departments. The CDC has not issued a national mandate, but it has upgraded its guidance, urging high-risk individuals to mask indoors and avoid crowded spaces as the variant spread. So far, this is no evidence that HX.1 causes more severe disease than previous variants, but yearly research suggests it may even evade immunity from older vaccinated and even recent infections. NIH or CDC scientists speaking microscope footage of antibodies versus variants. Vaccine manufacturers like Moderna and Pfizer say they are already working on updated booster targeting HX.1 expected to be available later this fall. But public fatigue is real. After more than 4 years of waves, mandates, and variants, many Americans are hesitant to return to pandemic-style precaution even as case numbers rise. Interviews with everyday people, footage of crowded events, maskless gatherings. Health experts warn that complacency could help to preventable surges, especially in school and high-density workplaces. Meanwhile, other countries, including Japan, Germany, and Nevada, Australia, are also reporting a spike in HX.1 cases. The World Health Organization has labeled it variant of interest, and global monitoring is underway. WHO press conference maps showing global spread. As the fall and winter season approaches, traditionally high-risk periods for respiratory illness, public health officials are urging Americans to stay informed, stay protected, and stay flexible. People getting vaccinated, updated CDC website, COVID testing drive-thrus reopening. So far, HX.1 is not a full-blown crisis. It's a stark reminder that the virus continues to evolve. And with every new variant comes a new round of challenges for communities, health systems, and the economy. HX1 variant, should we be connected? Subscribe for science-based updates on COVID, vaccines, and global health trends.